Crystal, welcome to YogoJo podcast, and many thanks to our amazing friend Satbir Khalsa from Harvard Medical School for introducing us. So could you please introduce yourself and take us back to the beginning? How did your journey with yoga start? Tell us a little bit about yourself and your work, and how did you get to the point in your career where you are at the moment?
Yeah. Thank you, Joanne, for giving me an opportunity to share my research work here. I began with my yoga research. As a child, we've been doing yoga, but then my yoga research, looking into the scientifics of it, began with my PhD guide, Dr. Sandhya T. Avdani at St. John's. So, what happened there is the yoga was there. Vyasa is the largest or the first yoga university. There was some collaboration there. And thus we started this yoga research. And I was very clear with my teacher, my guide, saying that I don't want to speak in yoga language. I want to be more scientific. And I had applied for my PhDs in medical physiology. So I wanted everything in physiological terms.
Yes.
So I was clear about it. So my journey began there. And by then, yoga was introduced into the schools. It had come into the school curriculum that yoga should be introduced. However, our guide thought that is yoga adaptable for children or no? Because until then it was unknown. And children are not young adults. We should not take it for granted that kids are young adults. There are a lot of physiological play that is going on inside. So we should take it very carefully. So we thought, okay, let's do it in children. Then the second thought came as in, why not try yoga? Because yoga claims that, your emotional, your social behaviors change. So we thought, let's have a study done in underprivileged children. Because in underprivileged children, you would see all these social issues and emotional issues which are more prevalent in them. So we thought of approaching the school who was educating these underprivileged children who are living in slums. So luckily I got in touch with a Christian school who was providing education to underprivileged school free of cost. So when we spoke to them about our ideas and our initiative, they were very welcome because they see so much of emotional and social disturbances in these children. That's how, the whole title came in having yoga in children between 7 to 9-year-old in underprivileged children. That was my thesis topic, my research. And we had to be very careful here to choose the age group. We wanted to take pre-adolescent because once they are adolescent, the hormones starts playing. So we may miss on a lot of things there. So we had to choose between 7 to 9-year-old. And we were so skeptical that whether children will be able to do pranayama or yoga. We were very skeptical. We never thought, will they sit in a place? And I did my work in 200 students. At a time it was a comparative study. So we had 100 doing aerobic exercise, that is your usual physical training, and the other 100 doing yoga. And I must say, children really, cooperated with us. As and when the days, the yoga sessions began, they were all quiet and, they settled down very well. And apart from the results, not everything can be quantified, right? So we had certain results which the teachers came and conveyed to us that, this particular child, was never doing it and he has picked it up, she is doing it, these things we could not quantify. So apart from whatever physiological parameters we had, the data what we got from students, other than that, there were many more points, but because of lack of time and lack of requirements that we needed there to quantify it, we had to miss it all there. Yeah.
Brilliant. Well, that sounds really fascinating. First of all, that you were able to access the school, but also the findings that, you know, even though you had some doubts in terms of whether kids would actually do that, they did that, and probably even stretched outside your expectations in terms of what you wanted or what you expected them to do. So what's your latest project? What are you currently working on?
Right now, I'm looking at the molecular level at the muscle. So we know that yoga is, improving skeletal muscle strength and endurance.
Mm-hmm.
And the one of the key determinants of health is skeletal muscle health. So only if your skeletal muscle has that strength and endurance, you'll be able to move around. And if you are able to move around, yeah, you can keep yourself fit.
Yeah.
So yoga is expected and it claims, and yes, in my own studies, I've seen the strength and endurance both improve. In a conventional mode of exercise, either you take endurance or resistance.
Mm-hmm.
Endurance is you have bout of exercises like that of running, like that of your sprint, like that of your marathon. These are all endurance exercises. In case of where you're doing weightlifting, your exercises are more of isometric. So you are resistance. These are called resistant exercises. So both these type of exercises have certain adaptations in our muscle. But yoga, we see we have both the type of adaptations that is happening. However, I mean, it is still not scientifically proved, and that is where I have initiated that we want to see what is happening at the skeletal muscle. Unlike the other type of exercises, where we look at the bulk of the muscle, we look at this bulk. So we're not looking at that bulk. We are looking at a healthy skeletal muscle where there is sufficient of your type 1 type of myofibrils and type 2 type of myofibrils. Means depending on the type of exercise, the kind of muscle that is built is different. It can be one type or two type. So if you're doing endurance, then a set of muscle is different that will adapt you to the endurance kind of exercises. When it is resistance, your bulk will increase. But if you see even yourself, you see that strength and endurance both as improved. Then how is it? How can both improve at a time? So that is my study. That is one of the initiatives we have here. And we will have to definitely, we have this issue of not being able to do this yoga studies on mice. Most of the studies happen in mice. But then how will we teach yoga to mice? So that's a major challenge we have. There is the autonomic nervous system that plays in the yoga because you are controlling your. Are you aware of the autonomic nervous system?
Yes.
Yes. So that is the automatic system that allows you to do your different types of activities in a day. So you are controlling that activity. For example, if you're doing an aerobic exercise, if you just think of running, what would happen to you? What happens to your breath and your heart rate? It
You
is an
start.
anticipatory response, right? So even if you have to pick something heavy, what happens? You take a and then pick it up and your heart rate is racing, right? But what happens in yoga? You are controlling your automatic system, your autonomic system, at the same time you're doing your exercises. So there is something that is changing at the molecular level. There are some studies who have tried to just initiate the molecular levels. They're saying yes, there is some kind of a change that is happening. The adaptations are not the same when compared to the other exercises. So yoga is different because you're controlling your automatic system. During the yoga exercise, you would see during your pranayama, your breath rate is deeper and the rate is less, right? 6
Yeah.
breaths per minute is where we have to reach.
Yeah.
And when you're doing the other exercises, you are hyperventilating. The rate increases, the rate of respiration increases, the number of breaths will increase. But in yoga, what are you doing? You're controlling it.
Yeah.
So that's where the change is different when compared to the other exercises. And I think I
Well,
need to.
I
Yeah.
totally agree with you that there is something happening on molecular level. And I've experienced that myself. My husband ran a marathon in 2018, and then I ran my marathon in 2019. It was in Florence. But before I ran the marathon, I went to Goa for 2 weeks yoga retreat. And we
Oh,
were exercising every day, twice a day. And on the top of that, I was running a little bit on the beach. My husband is fitter than me. And every time we went running together, he was running in front of me and he was faster. What happened in Florence? I actually beat him by half an hour.
okay.
So my time was, I did my marathon in 4.5 hours, just under 4.5 hours. He did his just under 5 hours. So I'm thinking, that's not a coincidence. So you mentioned earlier that I talked about breath. I'm aware that in many scientific studies, people say that we don't breathe properly. So we either breathe too fast or too shallow. What impact does it have on our bodies? That's inappropriate breathing.
See, usually what happens at rest, your tidal volume is less and your breath rate is higher and your lungs are not completely utilized. So you have, we use the word physiological dead space. Dead space is a area where there is no exchange of gases takes place. So physiological dead space is the space where there is no issues with the anatomy. There is sufficient blood flow and the alveolus is open. But then there is no exchange of gases taking place, probably because there is no sufficient air reaching there. One of the reasons. So, by consciously breathing, you have two types of breathing. One is thoracic and the other one is abdomen. And the muscles around it and the neck will help in breathing efficiently. So, otherwise, when you breathing at the rest, you are not utilizing your whole potential to breathe. And it is not possible to at rest to consciously breathe. You can't consciously breathe every minute. So at least taking a break and giving that complete breathing capacity, utilizing that capacity will definitely improve the oxygenation of the system, all the tissues. And yes, we know oxygen is the very important chemical for us to give us energy. However, this is a new concept that is coming in. Too much oxygen is also bad.
Mm-hmm.
Yeah. So that doesn't mean
Yeah.
that through yoga you are over oxygenating, but
Mm-hmm.
you are essentially oxygenating. So we are hypothesizing that in between this oxygenation and when you're taking your deep breath, you are contracting your muscles. There can be a small pause that can happen, which we call it as hypoxia. That's a new concept that is in. So that is
Mm-hmm.
yet another study we are doing to see what is happening to the oxygen tension. Are we over oxygenating? Are we under oxygenating? Or what happens to the oxygen tension when you breathe deep in and out while doing particular asana? So
Mm-hmm.
that is the next study that we are doing.
So how shall we breathe? You mentioned that briefly, but what would you recommend? And especially from the yogic point of view, what can
So
yoga
from
offer?
yogic point of view, we have both the type of breathing that is important, that is thoracic as well as abdominal. So abdominal breathing and the thoracic breathing, if we understand the mechanics of respiration, the more we inflate, the more we are calling in for air. And automatically, because there is a physiological limit, there are certain stretch receptors when you breathe in. Beyond that, it inhibits the respiration, and the exhalation takes place. So when you're abdominal breathing, what happens? Your diaphragm is moving down and compressing your abdomen. So it has an effect to at the same time, your chest is opening up, means the volume of your chest is increasing. So the blood that is flowing from the lower area of the body towards the heart is increasing. There is a pressure and volume change that is happening constantly. And when you're doing your deep breathing, it improves the blood returning to your heart. From the right part of the heart to the atrium and the ventricle, from there goes so much of blood to the oxygenation, that is to the lungs, and then comes back to your left part of the heart, then to the systemic circulation. So by deep inhalation and exhalation, both are important. That is thoracic breathing as well as your abdominal breathing. Both are important.
I understand. Well, that's just absolutely beautiful. How with yoga background, we can actually influence our bodies, and then by observation of the processes inside our bodies, we can then link it with those purpose design activities that impact how we breathe. So we very often hear in yogic language a term pranayama. So can you explain what it is and whether it is for everybody?
Pranayama is conscious breathing, is what I know and I understand that normally we don't consciously breathe. It is an automatic system. So physiologically, what we understand, the system which can be modulated in our body is only your respiratory system. The rest of it you cannot control. Maybe you can control your muscles. Other than that, that is running automatically cannot be controlled other than the respiratory system. So through pranayama, while you are bringing in change in your respiration, you are modulating the automatic system. Say you're calibrating it, you are calibrating it so that the effect on the heart as well as your respiratory system is much more lesser. So what happens, the more number of times you beat, the more you tend to you tend to fatigue, more you tend to worn out, right? So what happens with the your pranayama is you're bringing your breath up to 6 minutes per minute. So that will set or coincide with the what do you call it as sinus arrhythmia. There is a rhythm that the heart and the lungs follow. So that has to come into balance, and that balance is even brought about in the automatic system, your sympathetic and parasympathetic. So there is a switch on and switch off. So these two systems, when you switch on and switch off, there needs to be a balance. So either sympathetic can increase and parasympathetic decrease, or parasympathetic increase and sympathetic can decrease. So what yoga or pranayama is doing is, it is bringing about balance, not like this, but together bringing it 100% by increasing the parasympathetic and reducing the sympathetic. So what happens is, when you are given a task, you have the ability to focus, you have the ability to think clearly because your parasympathetic has enhanced. When your sympathetic increases, you have that anxiety that sets in. And there is a lot of confusion, there's a lot of deviation of your thoughts. There's a lot of distraction that happens. But when it happens with parasympathetic, you become more resilient, you become more, more focused and less distracted. So that goes to neuroscience, which
Yeah.
is not my area.
No, but you explained that in really approachable terms, and I'm sure everybody will be able to appreciate and understand that and actually see where the benefits are. So the pranayama, let's just focus a little bit more on that. So does it help only healthy people breathe better? How about those who already have some certain conditions, like for instance asthma? Many kids suffer from asthma, or problems with thyroid. Have you found any evidence that shows that pranayama improves lung function and performance, but also performance of other organs, not just our lungs, not just in healthy people, but also in people with certain conditions?
Yes, it is. It can be used as an adjunct, not as an actual therapy, not as a medication, but it can be acted as an adjunct. It can probably improve the working of a particular pharmacological molecule. Pranayama definitely helps the healthy, no doubt, and diseased also, especially when we're speaking about pranayama, you're speaking about respiratory system. It is definitely going to help even in COPD patients, that is chronic obstructive lung disease, pulmonary diseases, disorders. So it does help because you are controlling your breath rate. For example, forget about the deceased and the healthy. Let's look at ourselves. When you begin with your exercise and what happens at the end of the pranayama exercise. When you begin, you have this modulation that goes. But at the end of it, it is very, very smooth that you can see it in within yourself
Yeah.
to see whether the pranayama is helping you or no. It need not be in somebody else, but within yourself. You'll have to feel it to actually understand the mechanism of. Maybe you may not go into the depth of the biochemistry or the physiological changes, but to understand yourself when you begin in the morning, when you sit for pranayama, when you begin, and the end of it when you do it, how beautiful it is. It just flows. So definitely helps in obstructive pulmonary diseases, asthma, and certain allergies too. Hypersensitivity. If your bronchus is hypersensitive, they say it does help. It does help. And other diseases, there are therapeutic benefits of pranayama also, mostly on the cardiac system. Uh, they say, I mean, the efficiency of heart is improved, because see, the heart and the lungs are in the same cage. So anything
Yeah.
that is happening with lungs definitely is going to affect the heart. So through pranayama, as I told you, this is one system. The respiratory system is that system which you can control, have a voluntary control, and also bring in change in the other systems.
Mhm.
Yes, pranayama will help. However, further studies we'll have to see at the molecular level to see what is happening at the cell when you do pranayama.
In your research, you mentioned earlier that you focused on children. That's probably a more challenging area to do the studies, because there's significant amount of research that is happening on adults. So in your scientific studies, why is it worth starting practicing yoga early, or starting practicing pranayama early?
First of all, with children, we found that irrespective of the kind of exercise they're doing, their aerobic capacity is always higher.
Mhm.
Because as a child, they are jumping around, running around. It may not be structured. They already have higher aerobic capacity. Uh, but only if you look at the aerobic capacity as a parameter, or a respiratory system as a parameter, or the strength, any kind of exercise can bring about a change. But then where yoga comes into to have a beneficial effect on children is where they calm down, the focus that is required. And definitely not everybody has the access to the equipments or the park. So the very important, the best example is the COVID, where all of us were stuck inside the house. So when you don't need anything except for a mat, it need not be a yoga mat. It can be just a cotton mat where you can do some exercises and improve all the parameters and stay healthy. So also for the reason that the capacity of performance improves in children. So having this yoga in the curriculum helps them to just connect themselves, because with the technology we are connecting to the whole world but not to ourselves, which is very important. It's very important. I'm sure it is little difficult with the small kids. I think as they become adolescents, they will know why we are doing it. It should become like a ritual, calm down yourself, sit in a place, which is very important, and we started calling children as hyperactive. He doesn't sit in a place because we are not allowing that time for child to sit. So this yoga will bring them down. Yeah, bring them down is, calm them down. So with that calmness, when you connect yourself, you have that few minutes to see what are you. It's very important for an individual, whether it's an adult or a child, for a child to understand what am I. Because so far, what we learn is only by copying others as a child. So now, when the child is 7 to 9 year old, you have to see what am I? What am I doing? That setting in is very important. And that will set straight their whole life slowly over years. So that is very important, is what I felt. But in children, exercises in the confined place definitely helps. Children with disorders, children who are hypersensitive to exercise. While doing exercise, they start asthma, they become asthmatic. This exercise can trigger a lot of things. So these kind of children definitely can take up yoga. But I do not want to tell everybody that confine your children and put them into yoga and things. You should allow them out too. That is also equally important. But at times, it's very important that you make them sit in a place that will calm them down and connect to themselves, which is very, very important. And again, connect themselves. I don't think even neuroscience will be able to tell us how to, any kind of a result can tell us how we are able to connect to ourselves. This comes in yoga. In other exercise, it doesn't. You cannot.
I really liked what you said about getting kids to sit down on the mat and be quiet, because very often we just say, "Well, behave yourself, be quiet, focus," but actually we don't teach them how to do it. We teach them how to do their shoelaces. We teach them how to fold their clothes or how to make their bed, so they know what that term means. Make your bed, and they know how to do it. But actually, calm yourself down, sit down, be quiet. We don't teach them how to do that.
Oh,
But I think
yes.
with what you said, it's that yoga is that tool that teaches them how to do that, so then they understand and have that connection between what they ask to do and they know how to do it.
Yeah. And within ourselves, Joanne, my daughter came back to me and she said, Mama, you're so calm now. You know, no, as I told you, since I've started with my yoga studies, I have been also trying different types of exercise to feel yourself. First, I want to feel within myself so that I come out with it strongly. So I was doing aerobic exercise for some time, and I gave it up and I started with yoga, simple exercises and pranayama under a guided yoga expert. And she says within a week, one of them, she says, Mama, you become so quiet, you become so calm. So, the same thing can happen with children too. They need that tool to connect to themselves and sit calm.
You looked at the performance of the respiratory muscle, and you look at the performance of that muscle before and after periods of practicing yoga and pranayama by children. Why is this muscle so important to us? And if we look after it, does it mean that it will work properly for years for us, and then we realize benefits in our later life? What is that connection, and what is the most important information on that?
Yeah, respiratory muscles are very important for the reason because only when they contract, our chest will expand. You inflate, but deflate comes through elastic recoiling. However, when you inspire, your set of muscles, we call it as intercostal muscles, these muscles have to contract, and only if they are stronger, you're able to inflate your respiratory system. So, definitely, having a stronger respiratory muscle will help, whether it's your diaphragm or your intercostal muscles. You have a set of, when you're deep breathing, you have 48 to 51 set of muscles that are working at a time. So you are putting them into action. See these muscles on the neck, these muscles here, down. So all these muscles come into action.
Mm.
So when these set of muscles are trained, you tend to breathe better. Your performance into a physical activity also gets better. Like you said, you went for a retreat and you performed better. That could be one of the reasons. One of the examples to understand the respiratory muscle strength is for a longer time, if you're in isolation or not doing any kind of exercise and you run, you take a run. At the end of it, you bend down and you take gas and you say, my ribs are hurting.
Yeah.
Right?
Yeah.
That is an experience everybody has. So it is very important that your respiratory muscles are strong, the strength and the endurance also improves so that your activities are not disrupted. So your respiratory muscles will help you in inhalation and exhalation, which is a part of your pranayama.
Mm-hmm.
So through pranayama, even with the asanas, you have conscious breathing that would happen. Inhale, hold your position, exhale. So these are also the exercises to your respiratory muscles.
Mm-hmm. And if we have that strong respiratory muscle, does it mean that we perform better in later on in our life? Is that strength maintained, or do we need to exercise it on a regular basis to keep it at full?
Any kind of an exercise, Joanne, will be lost. The adaptations are lost over 3 months. And that is one of the finding in our study, that we saw the detraining in children, especially in children here. Here, over 3 months, we see all the parameters coming down. So it is very important to continue with your practice. Maybe days are there where your practice is shorter or longer, but having a continuous, consistent exercise regime is important, because over 3 months you get detrained.
Oh, wow. So what is really important is to get yourself into shape, or get the respiratory muscle into shape, but also then keep that sustained
Yes,
practice so that it does not.
Just like you eat to live, right? You eat daily. So you will have to do exercises. Maybe a meal must be small,
Yeah.
or you are having a buffet.
Yeah.
Right? So there are days, but you should not suddenly jump into a higher intensity of exercise. You need to slowly grade it and improve. Because 2 days you fast and you know what can happen to you. Similar way, your muscles also get detrained.
Yeah. It's like you cannot eat in advance. You just need to feed your body on a regular basis.
Yes.
Yeah. Many kids are into different sports. So boys will be all over football, rugby, cricket, and girls will be into ballet, netball, maybe running. So can you share some of your observations how practicing yoga can improve kids' performance at sport? But also, should they do yoga to help them with their sport performance? Or should they just stick to regular PE classes because it will be enough?
This is a very important questions which parents have to understand. That this kind of cricket or soccer, rugby, all these kind of a physical activity falls into to moderate to higher intensity. So what happens with these kind of activities is your muscles are getting worn out because your metabolites get accumulated in your muscles and even in your cells. There can be a lot of ROS. Do you know about ROS? Reactive oxygen species. These are free radicals. Antioxidants, oxidants, we take a lot of antioxidants to clear these free radicals. So, with the moderate and high intensity, especially the high intensity exercises, say your children are going for these sports where the whole day they are going to stay on the ground, run around, fast pace, slow pace, whatever it is. There's a lot of free radicals formed in the cells. So these free radicals, when they accumulate, they start degrading the cell, or say they cause harm to the cell. So doing yoga will give you a preconditioning where the breathing in, breathing out will precondition your system or your tissues so that this ROS free radicals formed uh, are not formed too much. So this is like a cleansing of these metabolites by yoga. So I would definitely suggest if your child is going for any kind of a high intensity sport, make sure that the child does yoga at least 2 to 3 times a week. Again, this is under yet to be explored at the molecular level. But yes, a lot of studies otherwise say that high intensity exercise will create a lot of metabolites and reactive species which can be detrimental to the cells. So doing yoga, because yoga is a low intensity exercise, it is low intensity and it has the capability to cleanse. When you say cleanse in scientific terms, we are yet to explore.
So, on the molecular level, because you mentioned that a few times, that's a correlation between movement and breath. Why is it so important? And that the yoga actually focuses on that, that there is a movement, you perform a movement and you breathe. There's another movement, you breathe out. Why is that correlation so important from, like, if you look at that on the molecular level?
In yoga, right? So this synchronization of breathing is very important because you're controlling your automatic system. You are every day getting up and calibrating your system.
Okay.
And as I told you before, that calibration or controlling your automatic system comes only with practice and in a practice like that of yoga. Otherwise, as I told you, even if you think of running, your breath rate and your heart rate is already increasing and you are into anxiety. But with a person who is practicing yoga has the predominance of parasympathetic, so is much more calmer. Your heart doesn't race as much as the other person would. So the combination of isometric exercise, or see in yoga, what happens is you're using your body weight. You're using your body weight, and also as you change your postures, your isotonic kind of exercises, isometric kind of exercises are being done. At the same time, you are synchronizing it with breathing. So during that 1 hour when you do yoga, you're calibrating your system, your autonomic system, you're calibrating, bringing it into control so that you do not allow it to race however it wants to.
It's a little bit like, having your system in reins and under control. So it's not doing whatever it wants.
Yes.
Brilliant.
You need to calibrate in such a way that your parasympathetic improves, dominates. You can use the word dominates. Parasympathetic dominates, and do not allow your sympathetic to dominate. So every morning you get up, you calibrate it, and then you get back to your work, and you know the change, you know the difference.
Yeah, definitely. What is your one takeaway message for children, for families, for teachers who are watching and want to get a dose of encouragement?
I would suggest all the parents understand the present situation first. That we are all connecting to the whole world but not connecting ourselves, which is very important. It is already lost. So it's very important to connect ourselves, and that is the first thing that we have to teach our children. Second is we do not require understanding that we do not require equipments to keep ourselves healthy or to improve our health. Third is stress management, which is very, very important in this competitive world. Stress management, because your cortisol levels decreases when you perform yoga and pranayama, which is an important hormone. More is detrimental, less can also be detrimental. So it has to be in that right amount that is being produced. It doesn't mean that you reduce your cortisol levels and is very good completely. No, it is a very important hormone. Stress management has to be taught, and the stress management can be done through yoga practice, pranayama, and yoga. So, in my studies, I found the correlation between the pranayama and yoga through the parasympathetic because we did collect the data of heart rate variability. So we had given a stress test to the students. They were given the arithmetic stress test, and continuously we collected the data of their heart rate variability. The heart rate varies depending on our activity. So even when you cough, your heart rate varies. When you are speaking, your heart rate varies. So there's a stress, the heart rate varies. And we see that the heart rate variability is much better, and they were able to perform well. So your pranayama and yoga, through dominating the parasympathetic system, reduces the cortisol levels, and thus bringing in the calmness and reduction in stress. So with that, you will be able to focus better, understand things better around you. So I feel these three things are very important now. One is connecting to ourselves to understand oneself. Second is the stress management. And along with the stress management also comes that crankiness coming down, the anxiety levels coming down. Because of yoga, they see an acute improvement or increase in GABA levels. GABA levels, we could not do it in our study, but the other studies show that there is an acute increase. When you say GABA, it is an inhibitory neurotransmitter. So for all the systems in our body, we have one switch on and switch off. Mm-hmm. So GABA acts as a switch off of unnecessary neuronal activity. So thus you are much more calmer and much more resilient, much more focused, because you don't have that unnecessary neuronal activity that is triggering from the external sources. So parents, definitely have to take up yoga for the reason because of the stressful life and connect to yourself and reduce any kind of mental as well as physical diseases.
Mm-hmm.
So
That's really wise words, and I'm just so grateful to you for sharing all of that and leaving us with the message that leaves us with that thought that there's just so much to do, and at least we can do something. So it's not that there's no hope, that there is hope, and that there is lots of there's things that we can do, and it's all within our reach, because as you said earlier, you don't really need much equipment or access to
yes,
top-notch facilities. This is all within your reach, so
just
that
requires time. That's all. It just requires that short time and nothing else. Maybe even without a mat, you can sit on the grass and do your pranayama.
yeah.
Of course, to do your asanas, you may require a mat. But otherwise, just taking a break to just sit down and modulate your breath is very important. One more thing I wanted to tell you is because children are sitting for online classes.
Yeah.
There are exercises called as trataka, that is eye exercises. So what I get to know of late, we were just discussing things, and because your sight is set, you know, so for a long hours you are ogling at your devices for long. What happens is your lens gets stuck. I mean, it gets you know eh,
Just
what is the word?
set in one position.
Yeah, it's stuck in the position, so you feel your vision is deteriorating, or so what they say is, while doing yoga, you put everything aside. One second thing is this particular kind of exercises which will help your ocular muscles, looking up and down and giving that exercise to your eyes will help. And also the humming.
Oh yeah,
Yeah,
having
the
the
humming kind of exercises, will allow you to vibrate the whole mouth and your system here, head and neck, which also has the stress relieving effect. So these are all evidence-based scientific results. So we can introduce this kind of eye exercises called Trataka, and also these humming, closing your ears, and you would see a lot of relaxation that happens in your head and neck. I felt, I should tell you this because all our kids all over the world are sitting with the device, and this has to be done
yeah.
with the children
But
as well.
it's also so simple, but also fun, isn't it? You
Yeah,
you
yeah,
can imagine kids like rolling their eyes all over the place. That would be just something that they would love to do straight away. And the same with the humming, because it's different, but it's also fun, but also
yes,
brings them so much benefit.
yes, yes,
Yeah. Oh wow,
yes.
wonderful. Thank you, Crystal, so much for everything that you shared with us. It was absolutely amazing, and really looking forward to connect with you on some other occasions as well. But for today, it's just brilliant. Thank you so much from the
Thank you,
depth of my
Joanne.
heart.
Thank you for having me here at YogoJo, and all the best to you.